Hello to each of you. My name is Tanya Pass, and I am the pastor at Brighton Rock AME Zion Church in Portsmouth, Virginia. Thank you for joining with us for some of our previous virtual informational forums. As you know, for the past several months, we have partnered with community health advisors as well as like-minded individuals to help us in this fight, to encourage us about COVID-19, to help promote safe behaviors. And we have been working together with a lot of people in the community to help us to do this. And so we thank you for being here. And so we have several presenters that will be with us on today. And so stay tuned because we're dispelling some myths. We're encouraging each other to continue those safe behaviors, and we're practicing those safe behaviors. So thank you for joining us.
Are y'all tired of wearing masks at all?
Oh, yeah.
Absolutely. I'm not. I still wear it. I still wear my mask when I go out in public, to the stores, when I go pretty much like everywhere. I still wear my mask. Like, it's very rare occasion I don't have the mask on. But for the most part, I still wear my mask unless I'm outdoors.
Mm-hmm. Well, yeah, wearing them indoors for me. I'm tired in a way because I wear glasses and they don't always work best with my glasses and they fog up, but I have to because of my job. So I'm always in and out the hospital. And I'm always, around close people. So I wear my mask in that aspect, but if I'm by myself or if I'm 6 feet away from you, I'm probably not going to wear my mask because it's just, I can't breathe.
Right. And I think the same thing. Like, I wear my mask because, it's still safe to do that. But since having COVID, I've developed asthma, right? So wearing the mask poses more challenges now after having COVID than it did before having COVID. So I'm absolutely ready to get rid of them. But in the same breath, I don't want to risk catching COVID again.
I know. And then the virus in itself, it keeps changing. So the vaccine or the boosters that we have, I'm not going to say it doesn't cover that, but it doesn't cover that. So we're going to have to continuously get boosters as they change it to accommodate the new virus that's out there. So, I mean, you got to pick your battles with these masks. So you want to make sure you wear the good ones. What is the KN95 or the N95 mask? Yeah. I know we have the just the surgical mask that are just easily disposable, but those aren't always the best ones to wear. And the ones that are the best, they kind of are not the most comfortable either. So yeah, I feel you on that. Yeah, because some people think that the pandemic is over and they are like right here on your neck and you kind of have to be like, hey, back up a little bit. So, and I guess it just have to be aware of your surroundings. Like if you're at Walmart, because not everybody thinks the same way you do. So you kind of just have to be aware of your surroundings and where you are. So I know at certain places, I definitely have my daughter wear her mask. Certain places, like if we're outside, I probably won't let her, I don't, have her, won't be too strict on her about it. But if we're going somewhere where we're at close quarters, she's wearing her mask for sure. Mm-hmm. For sure. So, I mean, this is our new normal now, working virtually, wearing our masks, social distancing. So what are your thoughts around adapting to that new normal? Do you think that it's been hard for you or it's easier? You like it this way? What are your thoughts?
I'm still a little uncertain if I like it or not. I think that change is not always easy, right? And I think that before we're completely out of this pandemic, or if we're ever out of out of it or free from COVID, I'm not sure what everything will look like. But some things, it's a plus in the change, but some things it's just like, I don't know, like I want to hug people. I want to sit beside someone, I want to do those things, but I do respect that everyone, still have their concerns about COVID.
Yeah, I don't think we're ever going to go back to the way things used to be.
We won't. And the sooner people accept that, the sooner everything will be all right.
Nah, people be all up in your face. They don't want to accept the new normal. No, because for me, my job is very hands-on and personal with people. So I know because I work with an agency, if somebody was to get COVID, either for our home visits or in the hospital, I'm not allowed to be there physically. But my job turns into a virtual. It turns into virtual, and that can be a little bit challenging for me and my client per se, because I work with pregnant moms. I work with people in labor and delivery. So imagine me trying to support my mom on the phone and the Wi-Fi not good. It's not ideal. So as far as that, that's a bit challenging for me, but being able to have the option for a virtual meeting is good. You know, funny, another thing that I found just a bit challenging is because I've gotten so, at one point we were just straight virtual. There was no meeting in person or anything like that. And I gotten used to being able to just roll over, wash my face a little bit, throw on a shirt and be like, hey y'all, I'm here. So you didn't have to do the whole 9, to go out the door and get out the door on time. And now that you can come in person, or, you have to show up for work at least once a week, and everything else. I struggle a little bit, just a little bit on that part, trying to get back to the old way. But I'm just, I'm thankful for the rest of the days where I can be virtual at home.
I think I struggled more being virtual than I did having to get out of the house to go. Yes. I think I'm probably the only one that was late for a virtual appointment.
Not a virtual meeting.
Right. Because, you get sidetracked, or you start doing something else. Like, oh, I got 10 more minutes. You start doing something else and you get sidetracked and you don't make it to the appointment. I clocked in more late being remote than I do having to go to the office, because getting out, like I had a schedule. I know I need to be dressed by this time. I know I need to be out. I didn't sit down. I didn't start doing something else. I stayed, to a strict schedule. So it's definitely a change being remote for me.
My timer, my alarm clock has been a lifesaver for me.
Yeah.
I have my little planner, my phone, ding, 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 ding.
Exactly.
You got a meeting right now, 5 more minutes. Get it together.
I would like to introduce to you today our special guest. His name is Dr. Keith H. Newby, who is a native of Norfolk, Virginia, and graduating from Norfolk State University, where he actually majored in biology and minored in music, and earning his medical degree from EVMS right here in Virginia. Dr. Newby is here with us. He is currently the Medical Director of Health Equity for Centera Health Systems, where his primary role is to aid in the development of programs that address conditions that disproportionately affect under-resourced and underrepresented communities, with a specific focus on the Black and Brown communities in Hampton Roads in Northeast North Carolina. He founded the James E. Newby Jr. Medical Foundation in honor of his late father, who was also a renowned cardiologist in his own right. He, in addition to his medical practice, he continues to develop his business enterprises. And we are so excited for Dr. Newby to join us today. He is very well known in this area. He comes to share with us his expertise, his knowledge, his passion around Black and Brown communities. And today he's going to share how that has affected, how COVID-19 has affected our Black and Brown communities, and going to share with us ways in which we can dispel some of those myths around COVID-19, the vaccination, to help educate us now how that we can operate safely or more safely in this climate. So together, just welcome Dr. Newby.
I'm Dr. Keith Newby. I am the Medical Director of Health Equity with Centera Healthcare and the President and CEO of Fort Norfolk Medical and President of the James E. Newby Jr. Foundation. I'm here today to talk to you a little bit about COVID-19. And trust me, I know you're probably tired of hearing about COVID. You've been dealing with this for 2-3 years. But why is it important? Why do we keep bringing it up? Because it's not over yet. We are in a better place, but we were in a better place a year ago where the case load was starting to fall down. But then what happened? Delta came out, and all of a sudden the cases escalated again, and they started dying back down again. And then what happened then? Omicron came up, and then it really escalated then. So it's important that we continue to talk about COVID-19, and we continue to say to ourselves, no, it's not over. Things can change, and things can go south pretty quick. So why is this important? Because the virus is what it is. It mutates, it changes. I mean, because the virus's job is to survive, and the COVID-19 is trying to survive. And what happens with vaccines are designed to help your body fight or to develop an immune response to fight COVID-19, but that virus is trying to evade it. So that is why it's so important that we take certain precautions when we're dealing with COVID-19. Wearing your mask. I still wear my mask everywhere I go. Why? Because I feel strongly that COVID-19 can still impact lives. I've seen 80 plus patients in my practice die of COVID-19. 80 plus, and that's all that I know about. I've had family members die of COVID-19. I've had close friends of mine who have died of COVID-19. And when you have that kind of impact on your life, the stress that is brought about, this is the time that we have to be diligent to not let our guard down, because we want to live, and I want to see you live. So, and why is this important for our community? Well, if you look at data, it says that the African American community is 2 to 3 times more likely to both contract, have complications, and potentially die of COVID-19. Why is that? Because of our particular lifestyle, our chronic medical conditions that we have, the things that doctors like myself have been trying to get you to do better with, and making sure that if you're diabetic, that you're getting your blood sugar under control. If you have hypertension, that your blood pressures under control. If you have coronary disease or certain heart conditions, that you're doing what you need to do, both medication-wise and lifestyle-wise, to make that an important improvement in your life. These are things that help stave off COVID-19. Now, vaccines. We're going to talk a little bit about vaccines. I know for a lot of people that is a dirty word, and I've brought this up time and time again, that we have got this come to this conclusion that the word vaccine means something bad. Well, let me share this with you. I've had the COVID-19 vaccine. My whole family has had the COVID-19 vaccine. Everybody's lived to tell the tale. My 92-year-old mom has had all 3 of her shots, first, second, and booster shots. Her sister, who is 94, has had all 3. My sister, my brother, all my family members have had their vaccines. Why is that important? Because A, we want to live. B, we know through data that the vaccine is safe and effective. I don't care what you've seen on social media. I don't care what some outside news outlet has said to you. I don't care what even other patients have said to you. What I care about is what the data says and what the literature has dictated to us, that we know safety and efficacy of this vaccine. It's helped many people live, and it's helped many people stave off COVID-19. I remember that I saw the caseload drop tremendously, probably about 2 to 3 months after the vaccine became readily available. And I saw a tremendous drop in cases. And I know that was coming directly from people being vaccinated. So I know the vaccine works. In my office, we were the first practice to get our hands on COVID-19 vaccinations. And we did probably 4,000 or 5,000 people we vaccinated ourselves here in this practice. And all those rumors you hear when somebody says, oh, Joe Blow died from the vaccine, that's nonsense. Joe Blow didn't die from the vaccine. Unfortunately, so rumors get started. We had 5,000 people we vaccinated here, no deaths, no complications, no nothing. People may have had an immune response as a result of that vaccine, and they may have felt tired, or they may have had a fever or some other manifestation as a result of the vaccine. But that shows you that it's working when it does that. So don't be afraid of that. Be afraid of COVID-19. The virus itself is the enemy, not the vaccine. So when I saw the caseload drop, I know it was coming from people taking the vaccine and being more diligent with that. Wearing the mask, taking the vaccine. These are the things that we can do to help stave off that infection. So I don't want you to be afraid of the vaccine. Embrace it. Understand how it works, what it's supposed to do. It's designed to help your immune response fight this virus. And that's all it's designed is to do. Now, a lot of people are saying they worry about what can happen 10 years from the vaccine. Well, the vaccine is gone 2 weeks after you take it. So, the one thing I'm trying to get people to understand, don't think that just because you see on YouTube or Facebook or Instagram that the vaccines cause this or cause that, don't fall down that pathway of listening to rumors that will get you killed. Don't believe it. I've been first, like I said, I've been vaccinated. I've had all 3 of my vaccines and I'm still here. I'm still enjoying life. I'm still wearing my mask everywhere I go. Why? Because I know that the potential is always there, but I feel much more protected having had the vaccine, having had the ability to feel like I'm in a place that I can protect not only myself, but my family. And I want people to just keep that in mind. When you're getting vaccinated, what you're trying to do is you're trying to not just protect yourself, but you're protecting your loved ones, your family members. How would you feel taking COVID-19, giving it to your family, and then one of them goes on to die as a result of that? Would you feel okay with that? And I know if you have any sense of self-worth and feeling of family, you're not going to feel good about yourself if you've done that to some family member or even or any loved one, coworker, whatever the case may be. So just understand that a vaccine is not just designed to protect you. It is designed to protect you. It's also designed to protect those that you love. So COVID-19 is a bad infection. We know it is. It's caused upper respiratory problems, cardiac problems, neurologic problems. It's caused a lot of issues in people. You hear about this term long hauler syndrome. These are people that have been infected and they go on to continue to have complications as a result of COVID-19 infection. I don't want you being one of those people. What I want you to feel is that when you're getting protected, that you're keeping yourself from turning into one of those individuals. Of course, the vast majority of people that get COVID-19 go through it, they recover, and they feel fine afterwards. But everybody doesn't do that. And you don't know if you would be one of those individuals that may get COVID-19 and have that long hauler syndrome. Do you want to take that kind of risk? I know I don't. When I look at the number of people that have been vaccinated, when you talk about millions of people who have had this vaccine, and we're all around. So I can't emphasize enough to you the importance of protecting yourself, protecting your family members, understanding what COVID-19 does in those unvaccinated. All the COVID-19 deaths I've had over the last year have every single one of them been in the unvaccinated. I haven't had one single death in a fully vaccinated person. So get that first shot, get that second shot, get your booster shot. Do what you need to do to protect you and your family members. Again, that life you save very well may be your own or somebody that you love. So I want you to take these things into consideration as you go to your day-to-day lives. Wearing the mask, you want to protect yourself. You want to make sure, because you can still get COVID-19 despite being vaccinated. But the beauty of the vaccine is that what it has done is it's protected people from severe disease and death. And that is a key thing that we want to make sure we emphasize. So please, I implore you, listen to what I have to say. Understand what I'm trying to convey to you. I have no vested interest other than seeing you live, seeing you thrive, seeing you live your best life. The best way to do that is by protecting yourself from this deadly virus. Take the vaccine, wear your mask, be diligent with your hand washing. Do the things that you know are appropriate that's going to help you help yourself and those around you. And again, that life you save could be your own.
Welcome, everyone, and thank you for joining another virtual informational forum for Brighton Rock's fight against COVID-19. We have been in this space for several months now and excited about having with us today Dr. Latoya Beatty. She has studied public health at Mercer University and currently works in family medicine. Her area of focus is community health and pediatrics, and she's going to join us today in a conversation about our fight against COVID-19. So let's welcome Dr. Latoya Beatty today.
Thanks for
Hi,
having
Dr.
me.
Beatty.
Hi, thank you for having me.
Absolutely. It's so good that you have joined us. Very excited about your participation with us in our fight against COVID-19. And what we've been doing for the last several months is just sharing with our community information about COVID-19, dispelling any myths about COVID-19, and sharing in specific areas, whether it's pediatrics or our senior citizens or our youth. And so today I want to start our conversation off with, I've been talking to a lot of people, and a lot of people have runny noses and they're sneezing. Some people saying there's allergies. And of course, because of COVID-19, many of us, we don't know what it is. So how can we distinguish between what's an allergy or what is really COVID-19? How would you help us with that?
That's a great question. And I'm one of those people who suffer from seasonal allergies, especially in the great state of North Carolina, where I'm from and where I live. And right now it is allergy season. Mm-hmm. So one way you can differentiate between the two is that with allergies, you are not going to have a fever, and you're not going to have shortness of breath, and you're not going to have body aches. Now with both of them, you will have sneezing, you'll have the runny nose, you may even have a cough. And most folks say their throat is scratchy with both, or even sore with both. You may even have a headache. I know for me, myself, I had a headache all week, and I still have a slight headache. So the first thing I did anytime I have a headache is check my blood pressure. I don't have high blood pressure, but I always just want to check it when I have a headache. So when I saw my blood pressure was normal, then I said, I still have my free COVID test that I got in the mail. So I took one of those. That test was negative. And then I thought about my allergies. I said, I'm pretty sure it's just that. And when I hopped on Facebook the other day, I saw a lot of folks complaining of headache as well, and they suffer from seasonal allergies. So with headache, you can have COVID-19 and allergies with both. But like I said earlier, the way to differentiate between allergies and COVID-19 is that with COVID-19, you're only going to have the shortness of breath, the fever, and the body aches. You will not have those three things with allergies, but the rest is fair game for both. And if you're always in doubt, feel free to use those free COVID-19 tests. You still can test at any clinic or even any pharmacy, anywhere. Free COVID tests are everywhere. So when in doubt, you can always just test again to be safe.
That's really good to have those tests to come in the mail, so we have them ready for us whenever we actually need them. And then, yes, so trying to distinguish between what's an allergy when I'm sneezing or a headache and what's really COVID. One of the things that we've talked about throughout this this journey in this fight against COVID-19 is our, and particularly the Black community, distrust around COVID-19 and around the vaccination. Should I take the vaccination? We were very hesitant in the beginning. I know that a lot of people have come around to actually doing it. Is there something that you can share with us to help the ones that are still on the fence about trusting the vaccination?
Sure. I was one of those people when the vaccine first came out. If you work in the healthcare field, you were one of the first folks to get the vaccine. So I finally got it in February of last year, and most of my colleagues got it a few months before me. So I was on the fence a little bit as well. For me, it was, I'm a lady of childbearing age. I don't have any children yet, and I just wasn't sure if it was going to affect fertility or something like that. And so once I started doing my research, and by research, I went on websites like cdc.gov, basically any website that ends in .gov, not websites that end in .org, and certainly not social media. A lot of people are going to Facebook, Instagram, Twitter, and things like that. Sometimes social media does have helpful information, and sometimes they do share facts, but for the most part, they're sharing personal stories and myths, and that's what makes things a lot worse for African American community, because we tend to gravitate to social media. So what I tell folks is, look at everything with a grain of salt that you look at on social media, and do the homework yourself. Go to those websites that end in .gov. And there's another website that I found actually last night. that the Center for Black Health and Equity launched a website called thetruecheck.org. So it's thetruecheck.org. And there's a website that's for African Americans. Is where you can go there and you can look at social media literacy and fact-checking skills to use when you're checking myths and things like that and stories that you heard. So I'll say that website one more time. It's thetruecheck.org, and it's specifically for African Americans and helping us improve our social media literacy.
Oh, wow.
Another thing, another thing to do is having speakers like myself and sharing resources and things like that that can debunk those myths about the vaccine.
Absolutely. So she's put up the truthcheck.org. That's very helpful because you are correct. Oftentimes we do go to social media and at the kitchen table or whatever and just kind of take it as it's factual. So thank you for reminding us the .gov is a reputable source instead of the .org or even on social media, because anything can actually be there. So thank you for that. I certainly do appreciate it. One of the things that I've noticed lately, which I was a little startled by, is that when we go into the public places now with the lift of the mask mandate, right? You're going into the restaurants, there are no masks. And I thought, well, did I miss a memo or something? But yeah, no mask. Everywhere you go now, you know, it's less and less masks. So how would you help us to address, you know, like, should we still wear our mask, and maybe where should we wear a mask? In particular, I'm getting ready to have in the many churches, Easter Sunday morning gatherings at church. And so I was even thinking, like, should we wear a mask or not wear a mask? Help me out with that one.
That's a good question. In terms of wearing a mask, I would say you should, especially in large gatherings. And by large, meaning a crowd of 20 or maybe even 10 or more, where you can't do social distancing of 6 feet or more, you should wear a mask. And especially if you're immunocompromised or you have those chronic health conditions like high blood pressure, diabetes, and what have you, you really should wear the mask. And certainly if you're not vaccinated. But if you receive all 3 vaccines, including the booster, and maybe if you even had the COVID-19 virus within the past few months, I can understand maybe wanting to take your mask off for a little breather if you're outdoors type of thing. But one thing to keep in mind, we tend to follow the United Kingdom. And right now, I was looking at the news last night, matter of fact, their cases are starting to climb again. And top health officials say that the United States, we tend to be 3 weeks behind the United Kingdom. So that's something to think about. So what we should basically do is watch United Kingdom right now. And they're saying the cases are starting to rise.
Wow. Well, it looks like we're going to have to live with this and manage it for a while, since it doesn't seem like there's an exit ramp. And so having these sessions around the education around COVID-19 has really been helpful for us. And I appreciate you once again carving out the time of your busy schedule to impart your wisdom to us, because we need it more and more. So thank you, Dr. Beatty, for dropping by Brighton Rock's fight against COVID-19. Thank you for joining us.
You're welcome. Thank you.
You're welcome.
I know that they just ended the mask mandate. The kids don't have to wear masks in school anymore, and some are relieved and some of them still have that anxiety. But because of COVID, do you think that has affected the children's education, or kind of just making friends, that peer interaction? How has that affected the kids?
Well, I have a lot of patients that are teachers in elementary school, middle school, high school, even teachers in college age. And what I will tell you is, as far as my daughter was in kindergarten during 2020. And so because of that, she did all her schoolwork virtually. Has it affected her in terms of social development and peer interaction? Definitely, because she's the only child. And so to not even have friends to learn how to manage things socially, it's a new experience for her. Educationally, thankfully, my daughter doesn't seem to have had any gaps. But what teachers are finding is that because there was such variability in home lives and in the way that the virtual learning was done, there's such big gaps. There's some kids that don't know things that they should at that particular point in their education. So it has hugely affected education. So teachers are having to spend a lot of time filling in holes and making sure that children are up to par with what they need going forward. So yes, it has affected education, and it definitely has affected peer interaction, because you can't even see your friends like you would like to. Makes it harder for people to just learn basic social skills because you are at home away from all your friends. So I definitely believe it has had an effect. How do we work around that? One of the things I'll tell you, my daughter has this kind of standing play date. It's virtual. The little girl doesn't live here. But if she did live here, it probably would be the same, because for a long time we were nervous about just having someone in the house because we don't know other people's activities. And so one of the things I've seen my daughter do is they play together and they're going back and forth, and it's kind of nice to watch them build their friendships by having a chance to talk to people at home, but also just interacting through FaceTime and other means of just having conversations. I think that is valuable in terms of helping them to develop the social skills. But it's certainly, if you are 7 and 8 years old and friends become super important and you don't get that, it's certainly going to affect you.
Absolutely.
For sure.
Yeah. So what are some of the myths that come with the vaccination? Why do people not want to get it?
Well, historically, there's a distrust with the health system, and especially public health. And that stems back from the Tuskegee experiment. And I tell people, do your homework, know your history. They did not withhold medication with the experiment. They didn't give them something with the Tuskegee experiment. They withheld the medication. Then I hear that, they developed that too fast. But what people don't realize, when you drive by EVMS or any teaching college that has a medical school, there are folks in that lab that are working. So this had already been, they've been working on this for a while. So it just so happened that the stars aligned and the vaccine was appropriate for COVID.
Right. So what are some of the common threads that go with the vaccine?
And even with the trends we hear, the myths we hear, I don't know what's going to happen. I've had 2 doses and a booster. I haven't grown a third head. My eyesight is still good. My appetite is still good. I have not had any health challenges. Now, with anything, there are side effects.
Right.
With it, you can take an aspirin
and have the side effects.